let me turn on my microphone. Good morning. We are ready for our Budget Review Subcommittee on Justice and Judiciary. And if we could have the roll called, please.
Senator Storm, Senator Webb, Representative Bray, Representative Decker,
Present.
Representative Kulkarni, Representative Sharp, Senator Mays Bledsoe, Senator McDaniel, Representative Bowling, Representative Elliott, Representative Petrie, Co-Chair Dietz, Chair Funky Frommeyer.
Present. Thank you. We will skip the approval of the minutes until we do have a quorum. So I'd like to jump to the third item on the agenda and ask the Department of Justice Administration and Federal Grants to please come to the table. I believe Angie, Lawrence, and Nathan. Good morning. You're probably familiar, but be certain that the green light comes on, and if you'll introduce yourself. Yes, and you may introduce yourself as well. And do you need any help with your presentation? No. Okay. All right. You may introduce yourself and begin. Thank you.
My name is Angie Lawrence, and I'm...
Angie, I think. So the green button.
It's on.
Okay. And just
Can you hear
pull
me
it
better?
close to you.
My name is Angie Lawrence, and I am the Director of the Grants Management Division for Justice and Public Safety.
Good morning. My name is Nathan Goins. I'm the attorney for the Justice Cabinet that helps with the grants management contracts and things of that nature.
Thanks, Nathan.
And I'm Zach Paget. I wasn't on the list, but I'm Assistant Director for Grants Management Division, JPSC.
Thank you, Zach. You may begin.
All right. Thank you for having us here. The Justice and Public Safety Cabinet Grants Management Division currently administers the following formula grants from the United States Department of Justice. The Stop Violence Against Women Act, or VAWA STOP, is a formula grant program that provides federal funds to strengthen law enforcement and prosecution strategies and provides direct services to survivors in cases involving violent crimes against women with a focus on domestic and dating violence, sexual assault, stalking, and sex trafficking. VAWA is funded through congressional appropriations, which are then distributed by a formula fund to states. The federal award amount available to each state varies from year to year. In Kentucky, the Grants Management Division administers and distributes the grant through a competitive solicitation. The Victims of Crime Act Victim Assistance Grant, or VOCA, is the largest grant program that the Grants Management Division administers. VOCA supports direct services to victims of crime throughout the criminal justice system, primarily through subgrants to rape crisis centers, domestic violence shelters, child advocacy centers, CASA programs, units of state and local government, and nonprofits. VOCA funds are used for victim services, including services for survivors of domestic violence, child abuse, sexual assault, stalking, trafficking, and crimes against the elderly, just to name a few. VOCA is 100% federally funded and distributed by a funding formula to states, and the amount available to each state varies from year to year. Like VAWA in Kentucky, the Grants Management Division administers and distributes VOCA funds to our subrecipients. While VOCA is a federal program, it is not funded in the same way as other programs. VOCA funding levels fluctuate due to the instability and volatility in its unique federal funding model. The sole source of funding for the VOCA Victim Assistance Grant Program is the Crime Victims Fund, which was established by the Victims of Crime Act of 1984. VOCA is wholly dependent upon this revenue source. The Crime Victims Fund is financed exclusively through fines and penalties from convictions in federal cases, not taxpayer dollars. Due to the nature of the federal prosecutions, there is an inherent variability which directly impacts funding availability to states. For example, the national accumulated balance in the Crime Victims Fund shrank from $13 billion in 2018 to less than $1 billion in 2024, which directly reduced state victim assistance grants from $3.3 billion in 2018 to $800 million in 2024. The impacts of this volatility were felt by every state and required the Justice and Public Safety Cabinet to reduce accordingly the amounts dispersed to state, local, and nonprofit agencies. At its highest level of federal funding, VOCA funding was available to support 133 awards for the 2020 subaward period, in contrast to the 97 active 2025 subawards, which directly impacts the number of services our state, local, and nonprofit organizations can provide. Our division also administers the Sexual Assault Services Program, the Burn State Crisis Intervention Program, and the Project Safe Neighborhood Awards. These federal awards are also awarded to states through a non-competitive funding opportunity, and award amounts to states are determined by a funding formula established by the U.S. Department of Justice. With the exception of VOCA, funding formulas for grants administered by the Grants Management Division have remained consistent with minimal fluctuations in the amount of funding awarded to Kentucky annually. In reference to the VAWA grant, there has been less volatility in the level of funding from year to year, but Congress in their annual appropriations bill has directed transfers from the Crime Victims Fund to be made to the Office on Violence Against Women, which funds the VAWA state grants. So you would ask about our efforts to manage VOCA funding fluctuations specifically. At the Justice and Public Safety Cabinet, we have worked with our programs to mitigate volatility in federal awards to stabilize resources for funded programs. In 2025, the Grants Management Division created a new funding formula for subawards that aligns with the federal funding formula. This model includes a base amount plus an additional amount based on the population. This formula is applied to our 4 statewide coalitions, which represent 70% of our award base. We also moved the period of performance away from the federal fiscal year to align with the state fiscal year, which allows our subrecipients to better plan their spending based on upcoming funding availability, and we've heard from our subrecipients that they appreciate that. The Grants Management Division also subawards funds 1 year behind the federal funding year, ensuring that subrecipients have ample time to prepare should there be a drastic cut at the federal level or a delay in the release of federal funds. Over the last several years, our division has responsibly retained a small reserve of federal funds, which has allowed the Commonwealth to lessen the impact from the reductions in federal funding resulting from the dip in federal fiscal year 2024 award amounts of $10 million, which is down from $18 million in the prior federal fiscal year. Fortunately, for federal fiscal year 25, we received an award amount of $17 million, which was much closer to the historical levels we've received and will allow for stable levels of subaward funding in the next state fiscal year. However, the inherent volatility of the Crime Victims Fund means there is no way to predict the future funding levels for VOCA. But the Grants Management Division will continue to be responsible with our funding so that we can maintain our statewide services to victims of crime. So thank you, and if you have any questions, we'll do our best.
Any members that have questions? So one question from a crime victim, their process of receiving access to those dollars. What's the typical process? And we do have a member that will be presenting today that I believe is a recipient of some of those dollars. But is there some anticipation that the process slows the speed of dollars to the crime victim, or is there anything that you've become aware that we should be considering on improving the efficiency of delivering dollars to crime victims?
Our program, it's dependent on when we get federal funding, like how that works. Typically, it's approximately the same time every year, but it can vary. But our funding goes directly to our subgrantees, and they distribute those funds through their programs to the victims of crime and the various work that they do. So I can try to get you a better answer, but I mean, that is the way our process works.
And in tying back to that, how would you determine the amount that maybe one subgrantee would receive versus another? Is there quality metrics that show that they're being great stewards of the dollars and getting great results with those dollars?
So part of it is depending on how much they ask for, and depending on how much we have available. But yes, we do look at past performance. Most of our subgrantees have been prior recipients of services, not all, but a lot of them have been. And so we do look at past performance, and we do look at how they spent their money. They have to report quarterly on their performance measures and quarterly on their financial reporting. Like, they report to us financially quarterly as well. So we know what they're spending, and if it ties back to what they said they were going to spend their funds on. And then we ask for the progress reports for what they're doing. And again, does that tie back to what they said they would be doing? So we do look at that, and that does impact it.
Great. And as we wrap up, I think one final ask I might have, and forgive me if I have this information, but I haven't found it. Those that have received grants, are you able to give us a summary of how that has broken out over our last fiscal process? Who's received what dollars amount?
We can get that to you. Like, I do not have that with me right at the moment, but I can get you that.
Yeah, I sprung that one on you. But that would be very helpful. We're working with diligence on our next funding process, and are hopeful that you'll receive what you need from the federal process. But if we have to be more diligent from a state, we want to be prepared for that. Thank you. Thanks for coming today.
Thank you so much.
As they're wrapping up, I would like to invite the Department of Juvenile Justice and Alternatives to Detention, Commissioner Randy White, and team. Thank you. Very experienced presenter, so you know the drill.
Thank you, Senator Fromeyer. It's good to be here. Again, I'm Randy White, Commissioner for the Kentucky Department of Juvenile Justice, and I have some guests with me today.
Good morning. My name is Elsie Berger. I'm the Executive Director for the Office of Support Services.
Hi, good morning. I'm Dina Burton, Executive Director for the Office of Program Operations.
Great. Thank you. Welcome. You may proceed.
Senator, I understand there are questions and maybe some educational opportunities for alternatives to detention. There are a lot of steps, and it's a complicated process. So what I'm going to do is to read through the steps and educate the committee as I do so, and feel free to ask any questions at any time. And thank you for the opportunity to present today.
Thank you, Commissioner.
So an overview for alternatives to detention within the Department of Juvenile Justice. Obviously, we want bad actors, and we want those that present a risk to others or themselves. We want them to be incarcerated until we can stabilize those individuals and provide intervention and to work with those individuals. However, there is a need to try and divert juvenile offenders that are very low risk, that don't present a danger to others, away from incarceration and the harmful effects of incarceration. Alternatives to detention are short-term, preferably no more than 30 to 45 days, short-term, less restrictive placements in which youth who meet criteria are placed after referral and assessments. These placements, while outside of detention, are still considered to be in what is termed as the detention continuum. There are several types of alternatives to detention, and I'll just shorten it down, call them ATDs henceforward. Home incarceration program or electronic monitoring, home supervision program or tracking, group homes, foster care, private child care, community programs, mentoring, evening reporting centers, in-home wraparound programs. ATDs are set forth in statute and have evidence-based programming embedded into their functions. In short, they are best practices. The goal of ATDs is to divert youth from secure detention who can safely remain in the community in order to serve them more appropriately and assure an adequate number of detention beds for offenders who present public safety issues. Overall intention is to keep youth in the community safe, ensure that youth do not get new charges while pending court appearances, ensure that youth return to the next court appearance. ATDs offer least restrictive alternative options to court-designated workers and district court judges prior to a juvenile offender being ordered to secure detention. A detention alternative coordinator is a Department of Juvenile Justice employee assigned to a geographic area to provide least restrictive placements for youth who otherwise would be in secure detention. DACs, as we refer to them, cover all 120 counties in Kentucky. The DAC has an array of programs and placements to which offenders can be referred when appropriate. The DAC helps to monitor the population in detention centers, especially status offenders, and to keep Kentucky in compliance with OJJDP regulations, or the Office of Juvenile Justice Delinquency Prevention. I know some individuals don't like all the acronyms. Mm-hmm. The DAC helps to expedite cases by monitoring the length of stay of youth in detention and to notify the courts and attorneys of youth who have been in detention for a long time. DACs work in close coordination and collaboration with CDW workers in the Administrative Office of the Court's Division of Juvenile Services within the Department of Family Juvenile Services. So close cooperation and collaboration with the Administrative Office of the Courts. There are several times when an ATD may be used. At police custody level, if they meet the low, moderate level on the CDW screening, the screening tool, and if home incarceration placement or a foster home or shelter is approved by a judge. Excuse me. At the initial detention hearing after a youth is taken into custody and detained. At any point during a court hearing in which a court is going to detain a youth and a less restrictive placement is available in the best interest of the youth. So that completes the overview of the ATD process, and I'll move on to how the process works for placement. The placement process for a juvenile not in secure detention begins for DJJ after the Administrative Office of the Court's designated worker has completed their assessment and evaluation actions relating to a juvenile and a juvenile complaint. At this point, the CDW and Juvenile Justice's detention alternative coordinators coordinate and collaborate to find an appropriate out-of-home placement for the juvenile that the court will approve. The placement process for a juvenile currently in secure detention begins with the DAC, or Detention Alternative Coordinator, completing their assessment and evaluation of the detained juvenile. When the DAC works with the court and attends the juvenile's court appearance to offer the court an alternative to secure detention placement. If the court approves the ATD, then the DAC refers the juvenile to the placement and notifies the county attorney of acceptance and placement. The DAC then monitors, subject to the court's conditions, the juvenile while in the ATD and reports any violations to the county attorney and the court. Programs offered. DJJ offers 3 specific programs within the ATD realm, as outlined in statute, electronic monitoring programs, and placement. These programs provided to the courts via DJJ's ATD resource guide, which is published each fiscal year and updated with as resources, information, as changes occur. Electronic monitoring is a program ordered by the court and operated by DJJ via a contract that allows the juvenile offender to remain in their home under close and constant electronic supervision. Programs are court-ordered offerings provided by DJJ via contracts with local providers for services, such as case management for resources and referrals, evening reporting centers for structured activities and education, multi-systemic therapy to assist juveniles and their families in addressing root causes, issues, behavior, and targeted case management to provide comprehensive Medicaid-approved resources and referrals to eligible juveniles. Placements are court-ordered out-of-home options for juveniles that require removal from the home or community for a variety of potential issues related to their charges or adjudicated offenses. DJJ offers placements for emergency shelter, foster care, independent living, and private child care via local contracted providers. Additionally, DJJ operates alternative facilities at the Frankfurt and Frenchburg group home for males. Again, that's Frankfurt and the Frenchburg group homes, and the Moorhead Youth Development Center for females. Number and type of contractors. DJJ contracts with several vendors across the Commonwealth to provide ATD placements to juveniles and the courts. The total number of contracts held by DJJ for ATDs currently is 16. The types of contracts match the types of programs and consist of electronic monitoring programs, which is case management for resources and referrals, evening reporting centers for structured activities and education, multi-systemic therapy to assist juveniles and their families in addressing root causes, issue behavior, and targeted case management to provide comprehensive Medicaid-approved resources and referrals to eligible juveniles. Finally, placements, emergency shelter, foster care, independent living, and private child care. There are 2 contracts currently for electronic monitoring, 7 contracts for programs, and 8 contracts for placements. Participation rates. This statute requires that all actions taken regarding juveniles charged with an offense are ensured an opportunity to be considered for the least restrictive alternatives options available based on the case. While not all juveniles are eligible for ATDs, all are considered within the process of the execution of the juvenile criminal justice system. So between July 1, 2024 and July the 30th of 2025, 1,652 juveniles were involved in this process. AOC diversion numbered 168 juveniles. DJJ DAX only 1,484. Success recidivism rates. DJJ supervises juveniles within ATD is directed by courts. This time frame can adjust based on many factors related to their due process rights and the efficient operation of the courts. Further, DJJ does not track recidivism for these youth. The system currently being used captures data, but it does not analyze. However, DJJ is in the process of replacing the ATD system with JCOMS, which will allow for a variety of reports. The court-designated workers administer the diversion program by statute and may be able to provide better information on success and recidivism rates as the program is structured to offer 6-month and 1-year terms with specific goals and objectives. So I think that that concludes our presentation in educational process for ATDs. It's a lot to put out, but it's a very complicated process covering a couple of different agencies. So we're happy to try and answer any questions if you have questions. Thank you.
Thank you, Commissioner White. I do think we have several questions, and thank you again for breaking this down for us. Chair Dietz?
Thank you. Commissioner, I've got a couple of questions, if I could. I guess, one, could you remind us of what the cost is to house a juvenile in detention per day versus what it is, the cost for an adult?
For the sake of being accurate, I can give you an estimate, but I refrain from giving you an estimate. I can get the exact number and the exact figure for you, but I don't want to just off the cuff give you a guesstimate.
Okay, so you don't have any idea as you sit there what it costs to house a juvenile on a daily basis?
I have an idea, but I like to be specific, ma'am, and I would rather give you a specific number than a guesstimate.
Okay.
It's much higher than an adult offender,
Right.
Because of the services and the staff.
Correct.
Yeah.
Okay. If
But
you
I
can
will
get that to
definitely-
us, I'd like to know what that number
Yes,
is.
ma'am. We've got that available.
And then when you talk about like the electronic monitoring and some of those other alternatives, does the family reimburse for having the cost of the electronic monitor?
No, ma'am. The DJJ pays that bill. They are, at times, if there's damage to equipment or things like that, we can seek restitution or seek charges, but the overall service right now is provided by us without a reimbursement from the individual family.
And then, do you know, is there a national model for juvenile detention?
I'm a member of what's called the Council of Juvenile Justice Administrators, and recently invited to attend their board of directors. And we come together 2 times per year, as many states as can collaborate. And it is a general consensus that there's no national model. For instance, some states don't operate detention, municipalities do. Some states, many states actually do not have day treatment centers. Some states have modeled their day treatment centers after Kentucky. So it varies. It is inconsistent nationwide.
And then my last question, do you have any suggestions for alternatives to detention for juveniles with habitual truancy or with contempt of court?
I think we're very interested in working with the Administrative Office of the Courts to get their perspective. That's on the front end. We're a service provider detention. We're a service provider for alternatives. But that's on the front end of the court system, and I would really want to work with our Department of Education and the Administrative Office of the Courts to try to work out some alternatives and resources for the judges and the courts. It's very interesting to me that our day treatment centers for kids that we offer alternatives for kids that may not want to go to school, can't go to school for whatever reason. And there's a number of dynamics that might cause truancy. So our day treatment centers, I think we've got upwards of around 27 or 28, some 5 that we operate, a number that we fund throughout the Commonwealth. And I think those are actually a gem within our Commonwealth that offers alternative educational opportunities for juveniles. So I'd really like to look into that more within our own department.
And would you, when you send us the breakdown of what it costs to house a juvenile in detention, can you give us what the cost is for the day treatment as well?
Absolutely.
Okay.
And again, I apologize, but I like to be really specific down to the penny.
All right, thank you.
Yes, ma'am.
Thank you, and recognizing that down to the penny would be helpful. One of the continuing in that line of questioning, I'm looking around for the gold standard, and it does seem that we have a number of ATDs that some perhaps has much better results coming from them than others. What is your office's responsibility, or what actions do you take to monitor the quality and the results that you're experiencing perhaps from one treatment center? And then how are you expecting that gold standard of consistent quality?
I think that we strive to, as we move forward, and we have a number of our programs are evidence-based. I think actually, as I'm looking at my list, probably better than 2/3 of our programs are evidence-based. What I would like to do going forward is to have a better tracking mechanism to measure success outcomes through the data. And you may be able to kick in, but I will say that with JCOMS, we're very excited that JCOMS to track this data is extremely labor intensive. It requires a lot of analysis, significant staff time, because these juveniles move into our system and they move out of our system. So we have to look at several different areas to try to figure out what recidivism looks like and what success looks like. So going forward, I think JCOMS is going to significantly enhance our ability to track this data. It will be much less labor intensive. And LZ, did you have anything to add to that?
Three quick points. One, we reached out to the Office of Juvenile Justice and Delinquency Prevention several years ago when I was with the cabinet, and we asked them specifically what is the gold standard in juvenile justice, and their response was, well, if you tell us what you're looking for, we can tell you a state that is doing that well or a series of states is doing them well. So to that point, there's not any one model that works, and with the statutes being so similar but not the same, there's different variations of that. So we work closely with OJJP and the Office of Administrative Office of Courts to work on this alternative program. We actually meet every Tuesday, myself and Ashley Clark, the head of the Family and Juvenile department over there, to work on these. As far as monitoring, we meet quarterly with all our vendors. I have a division director that meets quarterly with all of them. They inspect all the records. We verify all the expenditures. And in the past, within the past year, we have moved on and evolved certain contracts. So if we saw something that we did not like in performance, we would move on from that contract. We do not continue to operate that if we're not getting what we need out of the contract. So there are consequences for poor performance. Additionally, we have a system called Alternative to Detention. It is an existing legacy system, government-owned, government-operated, to fill a gap. We have since transitioned to what we call the Juvenile Kentucky Offender Management System. It is the same system that the Department of Corrections has, the Kentucky Offender Management System. We have adapted that system to provide our juvenile detention centers, the jail function in that system, as well as when we did that, we built the alternatives function. The jail function, as you can imagine, probably operates similar to a prison function, so that was a pretty easy adaptation. The alternatives was a little more difficult, but we've completed that, and we are currently in a pilot in our eastern region to move off of that alternative system into the JCOM system. Once we have that, we will have much more comprehensive data and be able to manage the data less manually. But for now, we manage it manually, and we do account for performance, and we do hold vendors responsible for their performance in the contracts. Thank you.
You mentioned, Senator Webb, I'll come to you just next, just one second. You mentioned Medicaid, and I'm going to just very, very basics of life. If we were talking about 3 pillars of wellness, that would be sleep, it would be exercise or daily activity, and it would be nutrition. Sleep is twice as important as the other 2. How do we get a sense that we're now working with this juvenile and we're trying to build some regulation of their life's daily habits? And that's important for all of us. Though I'm sitting up here with a broken foot, I do care a lot about daily activity and that's a core foundation to build towards mental health, mental wellness, and just good daily habits. How do we work with our Medicaid providers to just get to the very, very basics of these young, struggling children?
I think there's maybe 2 questions there. Is what our daily schedules look like maybe within our facilities, and Dina, you can probably be an expert on the daily schedules. And then the second part is how we interact with Medicaid. So Dina, you want to talk about the schedules?
Yes, it's very important in our facilities that we maintain specific schedules, daily routines, getting those youth back into those daily processes and expectations where they may not have had those, and building routines and expanding on those within letting them understand or giving them an understanding of how important that is, and that's the natural routine of life. So we build in those daily schedules, daily life schedules, and as well as wellness education on a daily basis.
Good, that's helpful, and I'd love to know that that's carried forward to all of the ADTs as well. Senator Webb, go ahead with your question, and we'll have to wrap up here in just a second.
Thank you, Madam Chair. According to the Kentucky Center for Economic Policy, I think $87,000 a bed for a secure facility a year for juvenile was reported recently. In 2019, I think you all reported it was about $313 or thereabouts a day, so somewhere along that range. But I think you mentioned a word called data. And as you look around the country for states dealing with juvenile justice, trends, potential reforms, what's working, what's not, data is the most critical thing that there is. Because, like you stated earlier, every state is different. Every demographic is different. We've got a high growing number of females. We have a gang influence and all these things that now we are dealing with. It seems like here in Kentucky, we'll get a little bit ahead of the trend or be kind of a model, then we'll suffer some setbacks in policy, and a lot of that's General Assembly's fault sometimes. But certainly data and AOC, it's got to happen for us to make sound policy decisions, and that's the key word. I serve on several national task forces on this issue, and data is the key. That is the key word, and especially when it comes to budgeting in urban populations, service deserts, and we've got those, and we will, we need to address those. But I guess my question is, a lot of these complaints with kids arise out of the school system, and they're part of the FAIR team and all that. We understand that, but how does the school system usually? In my experience practicing with kids in the school system wants rid of them. I mean, I guess what I'm saying is, do we have a sense or feeling that the school system is working with the CDW to reintegrate, incorporate, keep that kid in school in a traditional setting when it's a TikTok prank or something along those lines that we all see and happens every day? So I was just curious about how the school systems are take the recommendations of CDW and alternative, and if they're a partner in allowing those children to stay in school.
I think that what I would do is categorize my answer into what I know, and I really have an appreciation for our day treatment centers as an alternative. There's a number of dynamics, again, within the school systems and within the disposition of each juvenile that gets them on bad terms with their school system. It could be a pathology, it could be economics, it could be behavior, it could be a number of things. Sometimes it's group violence or security threat groups, group violence. So there's a number of dynamics. I refrain from speaking on behalf of the school system or the courts, but we're a service provider, and we want to provide those services and make those available to the judges and to the AOC and the CDWs and the families. And Dina, did you have any information to add to that within DJJ's perspective?
No, just to echo Commissioner White, we do try to work with the school systems and collaborate as much as we possibly can and be a resource. So.
Thank you.
More on the front end, Senator, with the CDWs and the DACs.
Well, they make recommendations. School systems don't always follow them or allow that child back into the same system, or they want to send them to alternative school immediately when it's not always merited. And I was just wondering how they view this. And I'm not about risk assessments much, and I don't have a lot of faith in them sometimes, and I get that. But I was just wondering how I know some districts are better than others, but that's just been an observation and a concern of mine moving forward. Thank you, Madam Chair.
Thank you, Commissioner White, and thank you for the work that you do.
As always, thank you. It's good to be here and present, and thank you for your support. Looking forward to the next time.
Absolutely. Great. As we prepare our next speakers, the Northern Kentucky Office of Drug Control Policy, Amanda Peters is going to join us. And part of these next three presenters are going to talk a bit about, can we get a little further upstream of some of the issues before members of our community become involved more deeply in the courts, or how can we work on the recidivism? So Amanda, thank you for being here. If you'll introduce yourself, and your light must be bright green, and pull that as close to you so we can hear you loudly. Thank you.
Definitely. Thank you this morning for having me. My name is Amanda Peters, and again, I'm the director of the Northern Kentucky Office of Drug Control Policy. And I believe I have some slides, if we could pull those up.
Okay. Yeah, we'll help you get those pulled up.
That might be this PowerPoint here. one's me. Thank you so much. I'm going to talk about our partnerships today and how we're collaborating across our region as well as the state. Collaboration is a funny word because I think a lot of people throw that out. It's more than just meetings. It's really getting in the nitty-gritty to solve complicated and complex problems. Let's see here. Okay, this is my board of directors. I have many slides that I'm not going to go through today because there's a few focus areas that I'd like to focus on. We are a board of 7 that was formed in 2015, so we just hit our 10-year anniversary, and the Northern Kentucky Area Development District serves as my fiduciary agent. And this is a public policy, public health, and public safety board. My mission is to assist with policy initiatives in our region, but I also collaborate across the state and consult with health departments, AOC, the Kentucky Office of Drug Control Policy, detention centers, police officers, and many other agencies across the Commonwealth. Our 3 key initiatives are to coordinate regional initiatives. One of those is our very large project, the CARES, which I'll talk about in just a second, and then our Northern Kentucky Addiction Helpline, and then again, that policy formation around substance use disorder, but also mental health. This is my helpline reporting. We have many metrics that I won't go into detail, but we do have a regional helpline. It was formed before the state helpline, and we've received over 17,000 calls since 2019. The majority of these calls come from families, from providers, and then a growing number of individuals are calling us seeking services. The overdose rates in Kentucky, we've seen great success in decreasing across the 3 years. We're the only state, or one of few states, that have seen a decrease over 3 years. And I'm proud to say in Northern Kentucky, we've seen a larger decrease in Boone, Kenton, and Campbell than we have across the rest of the state. It's about a 15% difference, and that can be contributed to many reasons. I'd be remiss if not, I did mention that there is a diversification of drugs, so that does play a part. But the access to naloxone has been crucial to these efforts, as well as expansion in treatment, but also our judicial programs when we're talking about pre and post arrest diversion, pre and post adjudication, pre-sentencing, and deferred prosecution, and collaborative efforts are really what can lead to these types of numbers. We use the sequential intercept model. Anyone who knows me knows that I get very jazzed up about resource allocation, how to navigate services and bring community partners together for planning. What the SIM model does is creates intercept points, those critical points of intervention of where we can help individuals and families. And this is coming from a criminal justice view. So in Northern Kentucky, we have fleshed out Intercept 2 to 5 very, very easily, and we're now working on 0 and 1. These are the crisis points, folks that are circling the drain between the emergency departments, police encounters, EMS, and those folks that may walk into a treatment center but just can't get connected for whatever reason. So this is a framework that can be used across the state. I know AOC has been helping with some of these efforts, and there is a youth model called Upstream that once we complete 0 and 1, which we hope to do by the end of the fiscal year, we'll start on the youth planning process. This is one of the things I'm also most passionate about, is looking at public health for better public safety. One thing that we like to say is healthcare, not incarceration. So if we can move those folks from the criminal justice system to the healthcare and social service system, we are able to support them and look at their needs from treatment and recovery, but also their social determinants of health that affect the families. Looking at the diversion and deflection, Northern Kentucky now has 17 positions of police social workers and navigators. We have more in our region than there is in across the rest of the state. These are the municipalities looking to do this here. We're rolling out Kenton County tomorrow morning. We've hired our navigators. We're very excited. If you're in Northern Kentucky, please stop by the Life Learning Center at 10 tomorrow to learn all about this. But what this program does is that's that crucial point with law enforcement. So we are seeing so many calls come across 911 that are social-oriented calls. They're not criminogenic behavior, domestic violence, alcohol calls, mental health. And I must say that alcohol is our number one problem across the state. That is what's hitting families. That is what is affecting our children. It has the most stigma. It's easily accessible, and we don't talk enough about it. That's what's hitting all of our local municipalities. When you go to our detention centers, our counties shoulder that burden, and the mental health and alcohol use is always coupled with other issues there. So these positions will be able to help these families. So we're hoping to reduce the burden for police, but also provide tools for those law enforcement agents that want to help, but they're not there to do that work. We need social workers, case managers, and folks to deflect the families that need help to the social service agencies, housing, employment programs that they need. One of the projects we're working on, again, is CARES. We did receive funding from the Kentucky Opioid Abatement Advisory Commission. These are the goals of that program, really to create a no wrong door system, continue harm reduction, and then working with Life Learning Center to advance those reentry services. Won't go into great detail here, but this is a complex problem or project that we're working on. It's created 18 positions, and we have a roadmap for recovery. I show these slides not just because it's Northern Kentucky, but I believe we have a model that can be scaled and spread across the state. This can be done with any infrastructure. Every area has a treatment provider. They have a hospital system. They have a community action commission. They have churches. They have a Kentucky Career Center. They have a community-based mental health provider. Not necessarily asking for more resources, but to leverage those resources, provide partnerships, and create plans of where folks can step up to do what they know how to do best. These are the 18 positions that we have created. So we do this within our systems to be able to have that crisis team. So we have created this clinical crisis and rapid reentry team, but it's also a social infrastructure project. So these folks are charged with helping these individuals that come through the system. We have over 800 folks enrolled in this program. These are the folks that are coming through our emergency department, Sun Behavioral Health, calling 988, leaving our detention centers. These are what we like to call is high system utilizers, maybe frequent flyers. I don't say that in a derogatory way. That's just what we use. These are the most sick, but also the most expensive in our communities that cannot get connected for whatever reason. Braiding and blending funding. We are using local funds. We are fortunate in Northern Kentucky to receive quite a bit of local funds, but that did come with a price. We have seen higher overdose rates, and even with last year with our decreasing numbers, Kenton County was still number 3 with fentanyl overdoses. It's still very deadly. So I just want to make sure that everyone knows that this is still a problem. We're still addressing it. We've made great strides, but there's more work to do. We do receive state funds, but most of these funds are from the settlement, and they are not taxpayer dollars. I like to show this slide. We put it in for our proposal with Kentucky Abatement Commission, but lots of in-kind money is going towards here from our physical court. So we have $1 million that we have received from the Opiate Abatement Commission. Our physical courts have put in another $500,000, but there is lots of other dollars that are put in kind from staff that is charged with doing this work to create the policies, the referrals, the warm handoffs that we need to create this project after these positions go away. Some of the investments that's important here. And then this is one thing I like to show of the different areas. What we've been able to do in Northern Kentucky is organize in hubs. So I like to show this slide too to show that lots of these strategies are already in communities. And if they can bring these partners together, I've been in many meetings where people have slammed their hands on the desks. I've been yelled at. We debate very passionately, but we do it for a good cause. And then we walk out and say, great job, I'll see you tomorrow. This work can be done. It's not pretty, but with the right people around the table, you can get it done. And it always starts with one conversation because somebody always knows the next person. So these are just some of the strategies that we're using from local and state and our community partners. Again, we just turned 10. Very short timeline here. We have many more advancements in Northern Kentucky, but many of these projects, the Office of Drug Control Policy, with the leadership of my fiscal courts and judges executives, have led, facilitated, consultant, or coordinated. What I do want to focus on today is that most of the folks dealing with a substance use disorder, mental health disorder, are working. It is a misnomer to think that the folks that we deal with are not working. They cannot seek treatment. They do not, cannot go to long-term treatment, residential, because of their children, because of their jobs, and there needs to be more support programs. So some different stats here, but just wanted to share that most of these folks are working. We need to continue this work, working with workforce development partners, our employment partners. If the folks aren't working, they would like to be. But we see with the compounding of charges, we see the felonies, there are so many barriers, and people cannot just get into the employment. Those in recovery, we've seen better retention, they're higher productivity, and miss less days of work. So again, there's lots of stigma of hiring someone in recovery, but if folks are given a chance, and they might need 1, 2, 3, or 50, they will get there with the right support services. Folks cannot recover alone. They must recover in their community, and it takes all of us. Some of the funding challenges that we see are listed here. I can tell you that the 2 key requirements for long-term recovery is housing and employment. If folks are able to have housing and employment, they have a much better chance of leading that full life of recovery, which is lifelong disease management. We're seeing Medicaid cuts coming down, more pre-authorization. This is barriers to treatment. I don't think Medicaid can be the great solver, but if it's used in the right way with good treatment providers, then it is very, very effective. We need to see more Medicaid adjustments when we're talking about youth and adults for aftercare. The community-based mental health providers are the ones that provide that aftercare. They can do the targeted case management. When someone leaves a detention center, a juvenile justice center, they leave a treatment provider. Their case management ends. They need to be referred and connected to this community-based mental health providers where the whole family can be treated, and they can do that extra resource navigation. Those are the folks in the community that are doing this work at every level and collaborating because they're forced to. They're stretched. They need more resources for the folks doing the right things. Medicare, we have an aging population. So when we're talking about parents and grandparents taking care of our youth, they cannot seek treatment. A Medicare person that needs to get Medicaid-assisted treatment, such as a Vivitrol shot, will cost $600 a month. We have evidence-based treatment that people cannot access on a fixed income when they are raising a family and dealing with more crisis before breakfast than most of us will see in our whole lives. They need access to treatment. Treatment vouchers for those MAT, which I mentioned, Casey's Law assessments. Families are calling to do involuntary treatment. Involuntary treatment is just as effective as voluntary. And whether it comes from a family member or it comes from a judge doing that diversion work, it is effective. When it comes to families, this is the only tool they have to save their loved one. I know it can be controversial, but it works. And for those folks to get that treatment, it's very complicated. You have to have 2 assessments, and our folks are not connected to insurance before this. And then it puts the family on the hook, and our providers will not partner with them because they can't get reimbursed. Not because they don't want to, but less folks are spending time in residential treatment residences as well as outpatient because they have to get back to work. So we need to look more at Casey's Law. Transportation. Folks can get to treatment. We have so much treatment in Kentucky. We have more beds per capita than in any other state, and that's great. But after that, where are they going to get those ancillary services? Where are they going to get those pre-employment services? And then also get to their job every day. They need to get to their support meetings. I've mentioned that folks cannot recover in isolation. When we're talking about those justice involved, again, the supervision to reunite families. We used to have organizations that would provide this program for free, but our nonprofits are stretched to the limits. We need more interventions because folks want to be reunited. They want to do the good work, and they just don't have the tools to get there. Our folks are told no more times often than not, and I could see why they would be disparaged and discouraged, and they just give up. We need to see a continuum of housing care. We're thankful for the work done by the legislature for HB 248 in the NARS and KIAR work, but it still needs some work. We don't know how to hold these folks accountable from local municipalities, and the burden becomes back on the counties and law enforcement. and we're not sure how to do that. We're waiting for the legislature to give us some guidance there. We also need to look at KTAR, Kentucky Access to Recovery Network. These funds were cut July 1. We don't know when they're going to be back. It does need reforming. It needs help. I'd love to talk more about that when I have time. But again, these residences that are doing the right thing need that support. These families need that leg up, and we need to see more programs that can house children. We're talking about primary and tertiary prevention, preventing first use and secondary use. We want to help the whole family. Stigma is also a number one barrier. We need to see more in that area. And of course, access to Narcan is essential. This is my staff, but I do want to mention this work is very personal to me. I'm one of those kids who grew up in this chaos. Without programs like Medicaid, organizations like the Brighton Center, having employment programs for my mom. She studied as a medical assistant, and that got us out of poverty. My dad was long-term incarcerated. We were on programs as HUD. I had access to therapy as a kid. That is tertiary prevention there. I would not have made it out without these programs. So I share that to say that these are not handout programs. They are hand-up programs, and if it's done right with the right people in collaboration, and evidence-based is very important, but I also want to say that Kentucky is a leader. Northern Kentucky is an innovator. We don't have the evidence yet, but we do have theory-informed strategies that will work when given a chance. So if we can keep investing in those programs that can be modeled across the state, we can see great success across our Commonwealth. Thank you, and I'm happy to take any questions.
Thank you. And we are limited in this room until 10:15. So stay seated for just a moment. Christy, you're going to be presenting next. So come forward. But we're going to have to rush you just a little bit so that we do have some time for questions. I want to ask you for a moment, Amanda, to go to your slide on the collective impact and collaboration is key. Where are our faith-based communities as part of the solution?
Those are embedded in working with our partners. One of the things that we've seen, especially in our rural counties, is they are shouldering the burden. We've expanded this project to our lower 5 counties in Northern Kentucky, but we're working on a faith toolkit. We've seen some across the state, but it doesn't quite address the needs. And we need to have what we call an a la carte menu for those. And so we're working with those partners to see where they can fit in, especially with transportation, pet services, and children.
We've seen that dramatically. Recently, we had an example out of Tennessee, and Ralph Alvarado, one of our former legislators, identified, and when I look around Northern Kentucky, I see a lot of our churches that have vans, 2, 3, 4, 5, and they're quite willing to be part of the transportation solution too. But I'm not sure that they've been invited to the table as frequently as perhaps they could.
They do a lot of aftercare and support meetings and helping those families, keeping that network.
Thank you for saying that. And I'd love to see them more clearly denoted so that we're more diligent about inviting them more frequently to the table. I think it's needed. Thank you for your great work.
Sure, thanks.
And thanks for sharing. Okay. And we now have the ION Center for Violence Prevention, which we already heard a little bit about the importance of the federal funding.
Yes.
And please introduce yourself and your guest.
Absolutely. My name is Christy Birch. I'm the CEO of the ION Center for Violence Prevention. And this is Christy Dangle, our COO. We're so grateful. Thank you for having us today and giving us this opportunity. It's an important month for us. It's Domestic Violence Awareness Month. And so we are rooted in this issue. Between the two of us, we have 55 years of experience doing this work. And so to be able to talk about ION Center and the prevention work that we're doing, we just greatly appreciate this.
Again, I echo Christy. Thank you all for having us today for the opportunity.
Sorry, we can't hear you.
Okay. Scoot over. I want to take a few minutes just to bring you, you all know who ION Center is, but I want to take a few minutes just to talk a little bit about, our uniqueness and the services that we provide. So we are the second largest victim service provider in the Commonwealth. We cover 13 counties across 2 area development districts, Northern Kentucky and Buffalo Trace. We are also identified as a dual designated program, which means we do both domestic violence services and rape crisis services. So when you think about that in those 2 area development districts, we are actually 4 unique programs that are designated by the state in the services we do. So what does that look like? We actually take a very community-based approach when serving survivors. We want to ensure individuals get the most comprehensive care and resources. So we partner with folks who are in this room today, as well as law enforcement, social workers, mental health providers, and a host of many other community resources. But what you see on the slide here is what Ion Center commits to. This is what we do for services for all the individuals who seek us out. We have an Ion Center staff person who is going to be answering that 24-hour hotline 7 days a week. We are going to be responding to the hospital when somebody presents for the emergency department. We will walk somebody through that justice system and all the resources they need to access that. We have therapy. We have 4 therapists on staff, one of which is designated to serve children only. This is just a quick idea of what we did last year. We had over 22,000 bed nights in both of our shelters combined, 67,000 meals to those individuals. With our help, we were able to get 64% of the folks leaving our shelter into what we call positive housing outcomes. Just this week alone, we have had over 27 kids between our 2 shelters, one of which who's a senior, and we're helping process through all of those great senior moments.
So at Ion Center, we work to take the best care of people who've been hurt by violence, but we got to get upstream as well. So we are dedicated to keeping violence from happening in the first place. And we have the largest prevention team in the state of Kentucky that is dedicated to primary prevention. And we do that in a multitude of ways. Our middle school program, which it's my space, it's all about helping kids set boundaries and respecting those boundaries, which leads us then to our Green Dot Bystander program in our high schools and communities. Green Dot is Kentucky born at UK. I was a co-creator of that program. It's gone to 42 states across the nation, and the Pentagon adopted it as its model prevention program. So that started here in Kentucky, and Ion Center is really leading the way with the dedicated educators doing that. That's a bystander intervention. It gives people skills, tools, and knowledge to see a high-risk situation and do something about it. We also are doing that. We're in 2 colleges, Northern Kentucky University and also Maysville Technical College, with these programs and with staff on board as well. And we have the first Green Dot city in the nation, which is an arduous, I can explain that at another time, but what it takes to be a Green Dot city in Maysville, Kentucky, Warsaw's next, and Covington is soon to follow. So these are all of the schools that we're currently in right now. We've actually got 9 that we're also adding this year to this mix. And so these are comprehensive programs that we become part of that school culture and are part of that community. We've got to get upstream and break that cycle of violence, not just take care of folks, but make violence reduced. And Green Dot is research-based and proven. Want to give you just a couple things in our region. What we've experienced in Northern Kentucky, we've seen some incredible youth violence. Our Florence mass shooting, we just had a 15-year-old kill his 15-year-old girlfriend. And this is 5 years of data from every high school student that we've trained. 43% of high school students in our region said that they've experienced an act of power-based personal violence, which means sexual violence, domestic violence, or bullying. So that's really profound to us. 85% of high schoolers we trained said that they would do a Green Dot now that they've had this training. 97% of our community members know somebody who's a victim of power-based personal violence. And so the Commonwealth is extremely impacted. 91% of folks who saw our trainings and participated in those trainings will intervene as well and feel prepared. So wanted to give, it is working and our community is telling us so. I'm not going to read this. This is you'll have this PowerPoint, but this is one of our beautiful students that we work with and how she really talked about now she can stand up and do something. She has those skills and tools. So when we look at, as proud as I am of all the things that we do at Ion Center and the progress that we make, we're facing challenges, increased costs. Our food budget for almost 60 people is $1,000 a month at each shelter. We have to rely on Free Store Food Bank. We have to rely on Costco and things like that. We all know that costs are rising. Can you imagine feeding 37 people on a $1,000 budget? So that is an increased cost. Our cybersecurity costs have gone from $30,000 to $70,000 a year just to protect our resources. Christy's going to talk just a minute about our budget.
Just really quick, we are grateful for every dollar that we get to do the services we do. And as you can see here, our budget is just a little over $5.5 million this year. And by breaking that down into those 4 distinct programs, you can see our conservative efforts to be good stewards of every dollar that we do get. One of the other opportunities that we take advantage of is volunteers. They provide us in-kind services that are directly affected to the survivors that we serve. We had over $30,000 of that in-kind service provided to us by volunteers this past year.
We do so much with so little. I'm so proud of how we can stretch this dollar. One of the other challenges that we're facing is aging facilities. Operational costs have gone up and our facilities are aging. So one of the things that Ion Center is doing in the next 2 years is looking at increasing our capacity and building a new shelter. We have 37 beds right now in Northern Kentucky, and we need at least 60 to meet the unmet need in our region. The last thing, I want to come back to our prevention, staffing levels. Senator Funky Fromeyer and I were talking. She asked me, what would it take to have an educator in every single school, middle school and high school in our region, both private and public? And what we know is we would need 32 prevention educators, each having 4 schools apiece to be able to be in our region. Right now, we have 5 dedicated people in high schools and middle schools right now in our program. What that would look like for Ion Center is we would need to secure an additional $1.4 million a year. And that's at somebody at $20 an hour. So that's what it would take for us to be in every single one of our schools. Just to give you that sense, we're not asking for that, but that's what it would look like. And that's what Ion Center has to work to secure. That's one of my big goals, is providing half of our resources in primary prevention and half in those intervention services so we can keep taking care of those hurt too.
So,
I'm like, whew, talked really fast.
So as I mentioned earlier, we are those 2 state designated programs, which means we are members of both state coalitions, the Zero V Domestic Violence Coalition and the Kentucky Association of Sexual Assault Programs Coalition. So when we come to talk to you about budget, we are talking to you about every service provider who is in one of those coalitions across the state. And what we know is last year, Zero V received $6 million each year in the budget. That provided services for 15 shelter programs across the state. This year, they are coming with an ask for $10 million each year of the budget cycle. This additional $4 million that's going to be asked for each year is providing each of those 15 shelter programs with about $266,000 a year to help offset those costs that Christy just talked about, because every one of our programs is experiencing that increased cost and ability to serve individuals.
As we talk about numbers, I'll leave you with a personal. We were at Hotel Covington having a lunch, and the person who waited on us came up to us. We were having a meeting, and she saw my Ion Center notebook, and she said, "You all saved my life when I was 16 years old. If I couldn't have walked through your doors and gotten therapy, I wouldn't have made it." And so we're talking a lot about numbers, but each dollar equates to someone and someone's loved one. And so we thank you for this time. We went really fast. So if there are additional questions, we would love to answer them.
Great. And we're going to invite Brighton Center to please come forward. And Christy, while you all are gathering up your things, I just thank you for making your time here in Frankfort, but know that you're very accessible, and invite our committee to reach out directly. Each one of us represent a different part of the state that are here in this committee today, but you spoke very well on behalf of the violence centers throughout the state.
Thank you. We appreciate it so much.
Yeah, thank you.
Thank you.
Senator Webb, are you going to be able to direct that to them directly?
Yeah, I was just going to ask them, if I may, just quickly, why we couldn't incorporate, we've got counselors in every school now. Why couldn't we come up with some program and just mandate the insertion of that into what they're doing in school on the payroll now?
Right, that train the trainer. That's something Christy and I have talked a lot about, but
Green Dot is a pretty substantial certification process and pretty costly, and so we would have to look at like cost effectiveness there. It's almost easier for us to go in and do it and not put that burden on, but I'd love to talk to you more about it.
Yeah, I'm just thinking about parity throughout the state. I mean, our shelter, we've all got the same issues you all do, and less services, so
That's right.
and more incidents per capita. So, yeah, I'd be glad to have that conversation too. Thank you.
Thank you.
yeah, I really love that. In fact, we've talked quite a bit about just that ability to handle conflict, and training our young people, candidly, from preschool all the way through high school, around the bullying factor, but that so quickly can lead to another level of violence. But recognizing that there's some basic conflict resolution skills that is part of your Green Dot training, which I think is impressive. Yeah. Thank you. Welcome, Brighton Center. Would
Thank
you
you.
please introduce yourselves each for the record, and then please proceed? And I do apologize. We have about 6 minutes.
Okay, so just, pull out the hook. I'm Melissa Hall Summer. I'm the Chief Impact Officer at Brighton Center.
Good morning, everyone. I'm Ellen Bates. I'm the Executive Vice President at Brighton Center.
And we're going to do this as quickly as possible. Ellen's going to give an overview of the comprehensive nature of our work. We understand that as you're making these, discerning these dollars, and every dollar counts, right? That we want to make sure understanding that upstream and how that works. And what a representation here today of how public and private dollars can really come to make some amazing things happen. So Ellen's going to start with us.
Yes, just real quickly about Brighton Center. We are a nonprofit organization in Northern Kentucky. Our mission is to create opportunities for individuals and families to achieve self-sufficiency. And we do that through family support services, education, employment, and leadership. And as a partner in the community, our vision is really to work with our community partners to strengthen our community. And we do that by connecting with our customers where they work and live as they pursue their hopes and dreams. So as Melissa said, we have a very comprehensive array of services rooted in Northern Kentucky. We've been doing this work for about 60 years, and we've grown to provide over 45 programs to the community, really growing as a result of listening to community voice, many times from local businesses and key stakeholders and the individuals that we're serving, listening to the needs that they have and growing our services around that, because we know that strong children come from strong families that come from strong communities. And so all of our programs are supporting that end. We can really look at our services in kind of three main buckets: education and training, financial wellness and homeownership services, and family and work supports, knowing that all of these kind of buckets are really providing individuals and families with the skills that they need to, as they go on their journey of self-sufficiency. And as they're building those skills, no one can take those skills away from them. And ultimately, as our families are getting jobs in better self-sufficient wages, they're pouring back into the Kentucky community. And we have over the last year served over 26,000 Kentuckians through those 45 programs, many of them who have had justice involvement, but also on that prevention side, working with young youth and young adults and our early learners before they get involved in the justice system, and really preventing that involvement.
And so you're going to hear us talk a lot about impact, investment, sustainability, and ROI. And that doesn't come as just the buzzwords we're using today. But when you think about agency impact, and this is one I just lifted up, we in our employment programs, we really invest a lot in employment programs. We see it as a great prevention mechanism, getting folks into jobs. For those who complete and are placed with our employment programs, their wage gain is an average of $26,621. And that doesn't mean they're making $26,000. That's a wage gain. So if they came in making $20,000, they're making $46,000. And so if you multiply that by potentially 200 folks being served, that brings about $5,252,200 back into Kentucky, into the economy, and supporting Kentuckians with Kentucky's talents and skills. We also look at return on investment. We take it very seriously when we have a public dollar invested. Yeah, we just don't say. We started out 60 years ago as a volunteer organization that had private dollars that supported us, and as we've gained to have more of a portfolio that includes state, federal, and local dollars, we've really challenged ourselves to make sure we're leveraging those dollars. So for every dollar we're bringing in from a perspective of state dollars, local dollars, federal dollars, we're matching that 105% by $1.05. And so we really hold ourselves to that standard of thinking, what does that look like? And when you think about things that happen today, we are recipients of VOCA dollars through our shelter. So that is so important to make sure that we're managing that. I'm not going to spend a lot of time here, but we talk about upstream. And so we spend a lot of time down where that ambulance is, right? We're all trying to get those services there. But we together, and I think that our partners in this room, are walking hand in hand up through the woods saying, where are people going in the water? Where are they going in the water? We have to decide that. We have to be discern that. We still need those intervention services. They are key and crucial, but we have to make sure that we're thinking about that. So when we think about our comprehensive services and how that relates and what that looks like, it's super important to think about capacity. And so we come forth thinking about a one-time investment that could support those services that are helping Kentuckians become self-sufficient, and looking at things like our facilities. We run the only shelter for runaway and homeless youth in Northern Kentucky, and our ability to modernize and gear those programs to make sure that they're setting those youth up, not only as a prevention mechanism from a justice position, but from a position of self-sufficiency and how they're going to progress in the future. That we're looking at service enhancements. How do we enhance and build and data? Senator Webb talked about data and the importance of data. Making sure that we believe that our investors, that our businesses, that Kentuckians, that our families deserve the dignity of good data and evidence, and we are committed to that. And then finally, organizational strengthening. I want to make sure that we talk a little bit about going deep with our youth, and the next one is just an overview of that, but we're going to go on to our youth justice. The question came up with a cost of what it costs for confinement, and we took a national number, which is about $70,000. I think it's a little higher in Kentucky, but we'll wait for that number to come. But when we think about $70,000 and think about $1,050,000, that confines and takes care of 15 youth, that level of investment. So when we look across our prevention continuum in our youth and family connectors, our youth leadership development program, and our stable families program, that kind of investment can serve over 600 folks from a prevention perspective. And when we look at our youth and family connectors, those connectors are getting out into all areas. We really want to build up in rural areas. I grew up in the country. I know what it's like to be a teenager in the country. Anybody else a teenager in the country? Yep, we know, right? And so how do you feel isolated there? In addition, we want to make sure that our urban core has those navigators as well, finding spaces and places that where youth can be, and they can, it addresses truancy, it addresses some of the key button areas that we have. Our youth services, youth leadership development, those middle schoolers, we're spending time with middle schoolers out of school. We're making sure that we're connecting with them. And last year we had 0 justice involvement across all of our youth leadership programs. So we are truly showing as a prevention mechanism. And then finally, stable families, which really looks at families as the core. When we build up families, strong children come from strong families that come from strong communities. We'll say it again. And how stable families are able to do that. And that really looks at keeping kids in school, coaching around that truancy area, keeping them in housing. I mean, housing is key and crucial. This program started with an investment by a private investor that said, we got to do some things differently. And the success of this program over the past 10 years has been multiple kids staying in school, families get involved in school, and progression made.
And Melissa and Ellen, I am so grateful for you to be here today. You provided us 2 summary handouts that I think every member of our committee has. And if you would be willing to stay around a little bit afterwards, the next group is waiting for us to clear out. But I did want to ask you while you're wrapping up, our committee for just a moment, we do have a quorum. So if you would kind of look over the minutes, I would like to get an approval of the minutes. If I can have a motion and a second from Rep. Sharp. It looks like, though, our clerk stepped out. So it might be difficult for us to confirm that. Is that good enough, or do we need to do roll call? Or that's good enough? Approval of minutes? I'm not sure. Okay. See, that's what I get. Such good, meaningful content that you shared today. So as we wrap up, thank you again for being here today. And if you don't mind being around so that any members might be able to address their questions to you directly. We do have approval of the minutes, and we had a second. Do we need to do roll call on that? No roll call needed. Okay.
Thank you all very much.
Thank you.
Thank you, ladies, for being here. And with that, any other questions for the committee?